So this is a presentation on biosensors in neurosurgery, specifically regarding wearable and implantable devices for monitoring purposes. Advances in hardware design have yielded devices capable of being worn by or implanted into humans for extended periods of time. When paired with wireless communications, they may be integrated with consumer devices such as smartphones or smartwatches. They're well suited for monitoring of physiological or pathological conditions in humans. And continuous wear can provide more than just a clinical snapshot of a particular disease or condition. So these devices might have several or many potential uses for the neurosurgeon, and they include monitoring certain parameters such as intracranial pressure, body position analysis, electrophysiology, and analysis of fluid dynamics within body compartments. So for intracranial pressure monitoring, it's indicated in a variety of neurosurgical conditions. Evolving metabolic and pathologic processes may necessitate continuous ICP monitoring. Current techniques involve placement of a device invasively, and of course, placement of devices is associated with risk of infection, hemorrhage, dislodgement, recalibration issues, device migration issues, and positional issues. Furthermore, current devices cannot be left in situ for prolonged periods of time due to the aforementioned risks. And there are various techniques used by the neurosurgeons to determine ICP, which I'm sure you are all familiar with. So novel invasive devices involving this new biosensor technology may permit for prolonged recording of multiparametric data from intracranially, such as ICP, oxygen levels, and temperature levels, and it may be all done simultaneously. So two devices, both developed by Raumedic, such as the Neurovent PTO and the Neurovent PTEL, might permit for ICP monitoring for prolonged periods of time. Uniquely with these devices, rather than them being tethered to a cable or a wire to transmit the information, they use a novel miniaturized wireless technology, and readings may be obtained by placement of a radio frequency coil around the area external to the skull. So they may be internal and covered, and recordings could potentially be taken through the skull. So non-invasive ICP monitoring is another potential way to measure intracranial pressure. So these usually rely on surrogate measurements to record ICP. So for example, optic nerve sheath pressure or pulsatile skull deformations, which are analogs to direct intracranial pressure measurement. So Oliveira et al. Proposed a system utilizing a wearable strain gauge to measure microscopic pulsatile skull deformations as a surrogate of ICP. Another potential method is the use of near-infrared spectroscopy, which uses a special electromagnetic frequency between 600 and 1,000 nanometers, and then it measures the absorption of scattering of these electromagnetic waves as a potential way to measure intracranial blood volume and oxygenation. So here's an illustration of some of these devices. B is the potentially untethered invasive ICP measuring device by Raumedic. C shows the radio frequency coil that can be used to obtain measurements by placing it over the site of the implanted bolt. And then D shows a wearable strain gauge type device that takes that potentially measures ICP non-invasively. So now we move on to body fluid composition. So traditional methods involve taking a snapshot measurement, such as a blood draw, CSF draw, to measure the composition of body fluids. Indwelling devices may be able to provide continuous information for the clinician. So these are permitted by advances in miniaturization of microfluidics and biosensor technology. And they've yielded what's called lab-on-chip designs, which are potentially capable of implantation. So these devices require a power source and a transmitter in addition to the measurement apparatus. Several prototypes have been developed and are in various stages of testing, such as the Cytocom platform, which will be pictured in the following slide. One commercially available device, it's not necessarily applicable to neurosurgery, but it demonstrates the technology, is the Eversense device by Sensionics, which is used for measurement of blood glucose, and it's worn by the individual and can potentially communicate with smartphones for telemetry. So these are some of the prototype lab-on-chip designs that could potentially measure body fluid composition. So now we move on to devices that might be able to help clinicians gain a better understanding of movement disorders. So as you all know, movement disorders often possess a fluctuating symptomatic course. And it's difficult for clinicians to assess using the intermittent snapshots, so like clinic visits and diagnostic tests. So wearable devices may permit continuous clinical data gathering, and they can be utilized to measure such parameters as joint angles, gait continuity, balance, and kinesis. So these are generally achieved using these miniaturized wearable goniometers, which are used to measure angle between joints, and accelerometers, which can be used to measure gait and balance. And here's a picture of a bendable and stretchable goniometer that's been worn over the knee that can potentially measure joint angles and may be useful for clinicians who are involved in movement disorders. So now we move on to electrical activity and the measurement. The second type of electrical activity monitoring is invasive electrical activity monitoring. So this is usually electrocorticography, which involves taking measurements directly from the brain surface or the dural surface. So these devices are miniaturized, and they consist of a grid of electrodes that measure electrical activity in the regions where they're placed. They have also the potential not just for afferent functionality, but also efferent functionality, which is obviously of a lot of potential in upcoming brain-computer interfaces. So there's several devices that are being tested and have been developed. So here are some images. On the left-hand side, there's a bispectral index monitor. And here are also some prototype electrical grids that are being placed, including some that have been 3D printed to match exactly the patient's cortical pattern. So in conclusion, technological advancements have permitted development of miniaturized technology. This technology may be worn or implanted for long periods of time. It can potentially provide continuous information streams for clinicians, and which would be superior to the existing snapshots that they receive during clinic visits or during point-of-care investigations. And obviously, these devices have multi-domain applications in neurosurgery and beyond. However, many of these devices are still in their early stages and require a significant amount of testing to be clinically proven. Thank you.